1632nd day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. SADAT SAIT, BHMS, Chief Physician, Dr. Said Homeopathy Clinic, Cochin, Aluva, Kerala, a leader at various homeopathy organizations with more than 27 years of experience, and the topic is management of ADHD and learning disability with homeopathy part 2. On behalf of IFPH, welcome Dr. SADAT SAIT. You can have the platform for next 45 minutes. It's over to you. Please proceed.
Thank you, sir. Thank you, Dr. Manoj. It's been wonderful session first time. I don't know what about the review, what people learned. This time, let's continue with the discussion of the medicines which comes up. How will you differentiate in a little bit manner? Let's see how things work out today. Can you hear me?
Yes, no problem.
Okay. Okay. I think we are stopped here with the confusion of the mind. How do we, the basic thing is that eliciting the symptoms. Once the symptoms are with us, then it is very easy. With homeopathy is 1 + 1 is 2. If you have the symptom, our medicines or the rubric or the repertory or the mathematica has the medicines. Repertory is a compilation of or collecting the the same rubric or same symptom from various various mathematica or various medicines and putting it in one place. It can be in a different way, either different authors, different teachers, different scholars have put it in a different books where they get more, it becomes more easier for them or depending on the principles. But in mind, most of the time it has to be kent, and you can put the synthesis also. You can take everything and put it here in one place. Synthesis gives you much better compilation. Okay. So now confusion. Parents will tell you that okay, once a patient comes in, see, all these things are becoming case taking, and it is not like any pathological conditions where you get the exact what are called. We can see the case also. We can palpate the case and find out, okay, this is the structural changes have come up. So this is the pathology. This deep the pathology is. So we cannot even quantify. So it depends upon the physician and the parents or the patients narration, and we have to quantify the symptoms. How much frequency it is there, how much is the strength of that symptom. So it depends upon that. So when a patient comes and tells your parents will tell you that whatever we said, he just blanks. He thinks that is confused. If we tell him that he is not getting it, he is not grasping it, he acts as if he doesn't know anything. So confusion of the mind, confusion happens when he cannot even collect the something we tell him, or the what I call, once we tell him to do this, or if we tell him two to three things, okay, from you go to that room, take that and bring it back or keep it there and come. Once he goes there, he just gets blank. He just forgets what is happening. There two rubrics can come. It is because of the memory loss or forgetfulness, or he has not understood what is happening. So taking symptoms and analyzing the symptom is more important. So quantifying is not easy. So once a patient comes up, we can take few cases and this one, and symptom is not, it can go wrong. The choice of the symptoms also can go wrong. So that is a difficulty here. But once you get used to the case taking, that is why the case taking is more important in a few cases. At times, in a pathological prescription, you can give in palliations. But here, if the medicine is not right, nothing happens. And it takes little more time than if treating the fever. It's not easy. Okay, once you take 15 days medicine, you give it, and you get a wonderful result. And it is also possible. I'm not saying that it's not at all possible. You get a good results even in 15 days time. So we'll go to the mind confusion. Lot of medicines are there. Okay, but you have to specify. If you can get a specified ones, take this. Okay, reading while you check out almost 15 to 20 medicines are on top, confusions. But reading while you get into 4 or 5 or 6 medicines. And these medicines or every medicines have a confusion. How it is different from other medicines. That is what we should know. What is the constitution of that medicine? What is the symptom totality of the medicine? So you have a reading while confusion, reading while. Okay, this is a prominent symptom. And you see that constitutional physical generals and mental other generals, and you select a medicine and check it out with this symptoms also comes with the medicines. So that is how with the totality comes in. I explained it to the importance of miasm in the first one. Okay, so alumina, you check it out the mind, alumina has a very slow in reacting to the command because of the uh, source itself. Source itself has a the what is called doctrine of signature. You can just compare that and you can find out the medicine if the patient has the other symptoms as well as prominence in other symptoms also. So it becomes too easy. Confusion. We have to take the. These are the common symptoms or symptom. Confusion can be a common symptoms, but when you get the writing while or reading while, that becomes a prominent symptom. Okay. Argentum nitricum. Argentum nitricum while writing while. It is not easy. The handwriting. Argentum nitricum, it becomes the paralysis or slowness in the mind as well as the physical. That is the prominency of, that is why the argentum nitricum is more prominent in the cases. When you get these two together, if the patient is too slow, you can compare the calcarea. Okay, so calcarea and this has to be differentiated. How will you differentiate calcarea constitution, uh, this one scrofulous tendencies and other miasmatic, this one, or the symptoms of the calcarea will be differentiated from here. Okay, when you go to the just that symptom, these medicines become too prominent, so you have to take it for accounting for these medicines also in the rubric. If you take out the symptoms, confusion, reading while, these are the medicines. When you add up other symptoms, you get a prominent medicine or you get a constitution. Okay, so that becomes more prominent. Bromium is also very good medicines, and ferrum iodine. Okay, loroceros, lilium tig mind. Lilium tig mind becomes confused. Okay, natrum carb. Natrum carb is another very slow medicine. You can compare this with the natrum mure. The confusions of natrum mure. Okay, mind discontent, displeased, dissatisfied. For everything he is not satisfied. We give chicken biryani, we ask them to write. If we give biryani, what is this? I'm not interested. You give that, not interested. Okay. In that case, anacardia has a dual personality also. And if he's discontent, if you whatever he likes it, if we give it, then he becomes a different person. So slight changes in the mind and the constitutional makes the things different. Natramure, calcarea constitution with this. Okay, sulfur. Sulfur is a rag picker. He is never happy. The child becomes smelly, child becomes dull, he is a dirty guy. Not always. Okay, sulfur has a different version also. So that is why you have to read 2, 3 books. Okay, Catherine Coulter has explained the different aspect of natramure in a not emotional ones and stuff like that. So different aspect can be seen in one patient. Okay, so these are the medicines we have to. These are the symptoms we have to take it for the repertorization and see the prominence which comes more, which gets into the more marks. Okay, display everything with natramure is one of the best medicines. He is not happy. Plus, family history also has to be seen. Family, if there is a problem or some other ones. Today also, I had a case of this one, ADHD, or maybe around 7th year or stuff. He started losing interest in studies, and we have to find out what is the condition. Is it a learning disability or ADHD or anything else? We have to differentiate. It is not because of that. When we went into the case, the family issues, the parents are fighting, the problem with the marital status is medium. This one. So we have to take that into consideration, and we have to rule out. First thing is that whether the diagnostic part is more important, whether the patient is ADHD or the patient is learning disability case, or I said simple, we can correct it. Okay. So these things has to be before branding a kid. He has the learning disability. His IQ test has to be done. Lot of cases we have to diagnose into it. You cannot just brand a kid into learning disability because that tag will be there for whole life or till about he finishes schools. So tagging a patient or branding a patient has to be very, very, very careful in learning disability and ADHD. And the medicine I gave him was natramure because of seeing the marital and the grief inside. Even the kids started explaining about this people's fight, and they are into almost into a diverse style. His grandfather parents brought him with one of the mother brought him. So and once we started discussing things, uh, we have to advise the mother to play a double role also at times. If the mother comes in, most of the time the kids comes with the mother. So double this one ends up broken marriages. So homeopath's role is not an easy one. We are homeopaths, we are counselors, we are case taking, we are everything. So please make sure that the symptoms are collected in a proper way, because we say that discontent, displeasant, dissatisfied. But what is the cause of it? Cause is the marital disparity or harmony between the this one parents. So cause ailments from maybe grief. So natramure comes into the this one and take out the totality of the case. That also can give you repertorization natramure. In those cases, the patient can change in a very faster way and keep follow once in 2 weeks or once in 3 weeks or once in a month. At least ask the kids to come if it's nearby. Or you have this one video calling. Ask them to call up today every day. You have a video call. You have a WhatsApp. You have a Zoom. So devote your time to get into it, and you will see the changes. Okay. I don't know whether I've told you one, Tracy. I will show you the case. I had treated her when she was in the schools. Now she's doing a degree. The handwriting, I think I have that case. Handwriting was so pathetic. It took me almost 1 year to bring the kids back. Now the handwriting is very good. She is doing it, she is doing a degree final year. So once we see the case, the kid has come for some seborrheic issue last week. I have the phone. I have the photo with her. But that makes you very satisfied. You will get the money also. Money is not always important in this case. If this is for our kids, how are you going to deal with it? Same effort we have to take it once we treat these kind of cases. But with empathy, not the sympathy. Okay? Mind, disobedience, tarantula. Most of the time you get single medicines in some programs. That becomes more important in prescription. Disobedient, we have that chamomilla is there, we have sina is there, but we have to differentiate this tarantula and this one. Chamomilla also is a very good medicine, but tarantula becomes more specific, almost like a, you can tag tarantula as a kid. Tarantula is what? Spider. The prominence of spider, the injections of the venoms of the spider, very, it will make you very restless. So we have to see everything. Doctrine of signature plays more part here in taking the cases. Mind exhaustion, aggravation from mental exhaustion. See, most of the medicines, our almost all the constitution medicines. But here the difference is selenium. Selenium, picric acid. If you have not read picric acid, exertion aversion 2, refer your books. Picric acid is one of the best. This one, picric acid, what happens is you have to go for the, if you have a brain CT done, you will have the loss of brain, this one also, gray matter and white matter. Thinning as will be there. If you have that, picric acid becomes one of the best medicine for those kind of a exertion aggravation. Exertion aggravation will give you mind fagging. Okay. So slight difference. Even you take lachesis, you know that talking and evening. Lycopodium and picric acid has to be compared. Aggravation, mental fagness, aggravation 4 to 8. So how to differentiate? You have the symptoms, plus if you have the lycopodium, if the patient is very fastidious, comes and keeps everything, usually in ADHD or learning disability kids, it doesn't come up. Reading, writing. Okay, lycopodium, most probably he is a ferocious, or he becomes a little more what I call judgmental. He tells that he orders people. So the mind of the lycopodium plus these symptoms. Picric acid, if we get that kind of a CT, because most of the time they goes to the psychologist or any neurologist, they order for all this and comes to us. Selenium is a very, 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 very mentally weak, very slow. Even the chocolate of Indian chocolate has that selenium. So that is why I asked them reduce the taking of chocolates. In the dark chocolate, it is little better than Indian chocolates. Okay, so these things, sepia, silesia yielding, very physical exertions. Silesia pulsatilla. Silesia, you know, no one, we have read the Kent, that what Kent has explained about the yielding nature of the plant. Silesia wants to be lonely. Silesia wants to be alone, but it cannot withstand the exertions and tension, physical and mental. Okay. Argentum nitricum. Argentum metallicum has a more of the depressions. Aurum has another suicidal tendency and getting into the uh, brain fags more. He cannot work. He wants to come and lie down. Calcarea phos, all calcarea groups. Califos is a uh, Califos is a mind remedy or what I call brain remedy. But Califos is too sensitive. Kali carb and Califos, too sensitive medicines. even for physical exertions. So differentiate it's not easy even for the differentiation with one symptoms, but this can be thought about it. Most of the medicines, it is very easy for us to differentiate with other symptoms adding to it. Mind busy. These are the three medicines. Veratrum. If you take mind busy, Veratrum is one of the best medicines. Apis comes second, then Brahmi. So Veratrum, uh, he feels that every time he is always busy. But what does he do? Nothing. Did he write today? Nothing. Did he study? Yes. Did he write? Yes. But how did you write? Do you know what is happening? Nothing. He is always busy. Okay, this kind of a character. Well, when the parents will come and explain it to you, this is one of the uh, beautiful. This one. He's always busy. Whenever we see, he is reading. Whenever he is doing something, he is doing this, he is doing that. But if you see the end result, what did he do? Nothing. He does something. He is occupied. He is busy. If you ask him to do whatever we have to do, okay, you go there and buy one grocery. He is busy. I can't go now. I am busy. I'll go little late. Okay. And gestures. Gestures is easy for us to find out. It's a physical expression, right? If we go wrong in the mental selection of the medicine, gestures we cannot go wrong, right? Case taking gestures of the patient becomes very easy. He comes and plays, he comes and does something, he picks up, he does something, he this one, he claps, everything. It is very easy. It is very easy for us to make it. Okay. So clapping of the hand, bell and stomach. We know that. I am not going to explain it too much. We see that and take up the rubric. So it's very easy. Homeopath rubric says it is given just like what are called clear cut. You don't have to think about anything. Take just as if you don't know anything about the materia medica, take the repertory. Okay, gestures. It is clearly given that this is the gesture. What we see in the patient, it is there in the book. Crossing of the hands. He will sit like this. Okay, and then he'll leave. Then he will sit. Cross. Clapping of the hand. Belladonna and stramonium are the two medicines. Mostly it is coming. It's so easy. Grasping or reaching at something. Every time when you sit, you just observe. He tries to grasp. He tries to take this. He tries to do that. Stramonium. Okay. Grasping bystanders at. He will not sit in one place. He'll just go to the bystander or he'll go to the mother. He will just go grab them. Okay. Grasping quickly. The more we see, before we see him, he will just start this one. You don't have to tell him or you don't have to ask anything. He just goes and grasps something, or the bystanders, or someone who just comes and pulls them and brings them. So grasping side of the bed, everything. Nexomica. This is a simple medicine. I don't have one by one. Grasping gestures has to be seen in the mentally retarded case also. Okay, MR cases. It is very easy to find out. Plus learning disability or learning or ADHD kids. Okay. Gestures, hands, motion, hasty, okay, lifting up hands. He will just come and say, rubbing together, cannabis indica. In this cannabis indica, if you just think about it, it is our ganja or what is that? Okay. Marijuana. So rubbing of hands. This is it, right? It is taken like this and puts it on. So you just see the what are called uh, what are called this one. The way it is seen, the rubbing, most of the rubbing cases, cannabis indica, it is rubbed in the hand. So the rubbing part is the medicine is cannabis indica. Simple. We have not done anything. 1:1. Okay. Just comparing. Spinning and throwing about, waving in the hair. He will wave. Raise your hands and wave. Okay. So you don't have to by heart any medicine. Yeah. Just as if you has it, if you know what is it, if you have a video taken or something. Most of the patients, most of the family won't allow you to take all this, but you know what it's just. You just take it, compare it. If you don't know what is the medicine, take out the repertory, just as okay, this fine, over. Medicine is done in front of you. Irritability. Most of the time, it is in the case of a children. So children in chamomilla, cinna, macabre. Macabre irritability is more. Cinna and chamomilla, you know, even the first year student knows what is the differentiation of chamomilla and cinna. Macabre is also part of the irritation. Okay, macabre has more of the mind irritation and fagness. So compare that. When questioned, if you ask questions, patient becomes too irritable. That could be two reasons. One, he knows that he is wrong. He knows that he has a problem, or he knows that this is not right. What he did is not right. So he just wanted to cover that. So if he just questions of why did you do right? Why you didn't write? Why should I write? I am not bothered. Teacher is not doing that. Teacher is telling me this. So when questioned, Nixomica comes. Spoken to when we just talk to them softly. He knows that the situation is not right. Chamomilla gets up. That is one questions and this is spoken to. So that is the difference. Okay, Nixomica and Chamomilla difference is when you start questioning the kid or questioning the person, when he gets irritable faster, and we know that okay, when you question it is one time it's little good, but he gets beyond that, then it is Nixomica. Chamomilla is too irritated, even when we start talking to the kid, he gets irritated. Okay, spoken to. Now, talking while. These are the medicines, but it's not too quantified or 3 months or 5 months. Here also 2 cream is coming up. So little medicines. Here talking while we have to differentiate in a proper way. Talking while, spoken while, question. This becomes what I call three different symptoms, but we think that it is the one symptom. Okay, so differentiate it. It's so easy. ADHD and learning disability cases are not tough. It is easy, but we have to spend little time to get the details. Memory. Whatever he has to read, he forgets. What he has to read for tomorrow, he doesn't know. Okay. That is the differentiation of others. He forgets words. Bareta Cup, idiotic personality. Okay, and plump up. Plump up different because the neurology and the brain has a slowness and brain has a problem. Okay, structural changes will be little more in plump up and than the Bareta Cup. Okay, memory forgets. If he has any problem because of any injury or something, if he doesn't have also, but paralysis, Beretta cup doesn't have that kind of brain damages. It could be more of a functional. Lumpum could be more of a structural or the memory area. Okay, right for what he has to vote. He forgets it. What he has to write. Cannabis indica comes in the most of the this one, symptoms. Another medicine which is coming up is capsicum because of the restlessness. Capsicum, you know, no? In ADHD cases, capsicum becomes little more prominent. How does that capsicum becomes prominent? It's chili. So everything is restless. Everything is faster. Everything is furious. Compare tarantula and capsicum. Okay. Capsicum is one of the best medicine, and all thanks to Dr. Suresh of the Alapi Charthala. He has given me this comparison. So, and it has worked very good also in this kind of because I started trying when the tarantula was not available in my clinic. It got finished. So I thought, okay, we'll try some other medicine. Accidentally, just gave it for a kid, and the kid became little better. Then I continued the capsicum 30, 200, 1 up, and that restlessness came down. Patient becomes a little more concentrated, memory weak as well. That is, I said, compare tarantula and capsicum. The worst thing is that in ADHD and learning disability, your favorite medicine, whatever use it for the pathological prescriptions, rarely come off well. Because my favorite medicine is phosphorus. But here, most of the time I give phosphorus in almost all the viral fevers to the respiratory complaints to most of the cases, even for the uh, different cases. But here what we have to do is we have to find out the symptom whether that is uh, coming up in the mind level for the phosphorus. Then only this works here, even partial. Okay, so very rarely uh, the your specific medicine, so your favorable medicine has any actions here. Okay, mind mood changeability. Ignatia lycon next moscata. Next moscata is one of the best medicine for change. You feed the mind. It has all the features of arginine nitrate. Nexomicin. Nexomicin next moscata is entirely different, but it has more uh, in-depth or it is a deep mood swings. Pulsatla is a softness and you know Pulsatla mood. Sarasapatla. Zingam, one of the best and always should be thought about medicine is Zingam in the case of learning disability as well as ADHD. What is the main? This one is the patient or the kid repeats whatever you tells you. So mental retardation case also you have to think about this medicine. Zinc. Zinc is a metal. You know what is the poisoning of zinc metals? Okay, zinc. Zinc met. It's one of the best medicines in even in case of ADHD. ADHD, the kids will repeat. And in the sleep pattern, if he just has the shaking of the involuntary shaking of the leg, nothing is to be asked. Give zinc. And zinc can be given in higher potencies. Okay. 33x is little dangerous. 3x is we have to be very careful. More the because it's a metal, give it a little more higher potency so that medicine acts faster. That's my experiences. Okay. Speech. This is a physical symptoms or a physical expression. It's very easy, right? Hasty, foolish, hyosamus, barretta cup. And barretta cup, one more thing is that if you ask the kid, he always smiles. He gives a whenever if you ask what is his name also he smiles. He'll we'll have a wicked smile on his face. Always he smiles. So Beretta carb we can identify with that smile. Whatever we say, he just listens to you with a smile. He just stands, doesn't ask anything, doesn't answer anything, he smiles. Our parents also, whatever they tell you also, even if they hit him also, he just smiles. That is a foolishness because we have to have some what are called expressions. Either you get angry when you hit, or he responds. He doesn't do that most of the time. He just smiles. So that is something which is this one. Foolish speech. Here, this foolish speech becomes more prominent if you get it. Hyoscyamus is the medicine. Hyoscyamus can be compared with the other hyoscyamus symptoms. He doesn't like to wear his clothes. He throws away the clothes. Okay, all that when he becomes that symptoms comes in. Hyoscyamus is the medicine. Hasty speech. That is very easy to find out. Hasty. I have my cousin speaks very, 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 very fast. If you ask one question, he'll just start like a rocket. Whether he is talking properly, sensibly, coherently, nothing. He must be talking sensibly, but it's not easy for us to find out what is he talking. We have to ask him, stop, repeat. That also it's not possible by the kid. So that becomes little more difficult. Okay. Incoherent. We know that. Again, cannabis indica. Lacuses, loquacious but incoherent. Cannabis indica, what happens is when you get into the bang mood or cannabis, marijuana, that this one, who talks sense. So that is with the other symptoms, cannabis indica is one of the best medicine for learning disability and ADHD. Okay. And rest talks. Rest talks also we know that restless. And he talks something what he doesn't know. Stramonium. I don't have to explain too much of the stramonium incoherence. Stramonium is a poison. Okay. But once we give it, irritability starts, mind irritability. Every time it's a mind irritability, he talks faster, incoherently. Whatever he talks, he doesn't understand. Okay. Again. Okay, nonsense. Hyoscyamus. Slow, helaborous, slow. Why? It has a problem with the brain. Helaborous child. It is what is that called? Okay, and slow in the treatment, slow in speech. Lacuses or loquacious. We say that lacuses always keeps talking, but at times lacuses also we have to think that in a different way. That is why Catherine Coulter book is become more important. So Natramure has a what we have read in the Kent, we know that. But Natramure has a different version also. Read Catherine Coulter. It will give you different version of Natramure. So Natramure has 101 versatility of the constitution or personalities. So we have to know everything. So one medicine is not that what Kent always says. No, Kent is not always right. Different authors have given the different versions of Kent, but basic the characters are the same. They are not contradicting, but they are showing the different thought processes in a different way. Okay, unintelligible. That is almost equal to dullness, but is not slight difference of the dull and unintelligible. Okay, not something big deal about it. It's easy to find out. Okay, wandering, mind wanders. We know the symptoms, no? We know the medicines. Belladonna. Belladonna is very fast congestion, brain congestions. It is always thought process of the belladonna is always keep changing. Highly sensitive, highly congestive. So we have to find out differences. Hyoscyamus, lachesis. Again, one wanders from one side to one other, one topic to another topic. So right now you must be telling that okay, I'm talking of the snake or talking of the zoo. Next second he will be telling about his class. Okay. Again, next mosquito comes into almost 10 to 12 cases of rubrics. Next mosquito, stramonium. Okay, obstinate, obstinate. That is very easy to find out. This is all not rocket sciences. It's too easy. Even the first year kids can find out. First year student can find out. So parents will come and tell you against whatever was proposed. Here he will object to anything what we say. Urgent or metric. If we tell him that okay, go and do this, he will say no. He will have his own way of doing things. He will object on the spot. Then we will have to take our actions to get the things done. It is not easy with the kids to make them do something whatever we have to. We need it. So urgent and critical. Children yet cry kindly spoken to inclined to grow fat. Constitution cries fast. Calcaria declares there is nothing matter with him. He will say, I'm not right. Why did you bring me? I don't have any issues. Your mother is not, oh, mother don't know what is she doing. Who has a problem? Mother, not me. Okay. Mind, again offended easy. Mind, playful. So everything comes in mind. That is the most important. That's the beauty of the case taking. Even if you come to even the patient comes to the clinic, you know what is he doing. He goes to what I have done is I have a playing area. I had a playing area in my clinic. Kids used to come, go there directly and start playing. They are not bothered. What is happening here, they are not bothered. We'll have to go there. Okay. So alternating with melancholy. They will be playing for 2 minutes, then they will becomes this one. For Soranum. Soranum is also one. Indisposition to play. Always the kid wants to play. Riam, he doesn't want to study. He wants to play. Riam with a sore smell or sore body or the other symptoms of Riam. Mind obstinate. Riam. Another obstinacy is Riam. He always wanted to play. He doesn't want to sit and doesn't want to write. If there is a small sore swelling or body or his clothes become sore, Riam is the medicine. Mind pulls, desire to pull one's hair. He might pull their own hair, he get angry, they will pull hair. The parents will complain, parents will tell, we have seen him pulling his hair, or he will come and pull others' hair. So desire to pull hair is belladonna. Reading hours too. Silesia, you know what is the doctrine of signature. Silesia is very, very slow. Nexomica, reading, he doesn't want to work. He is lethargic. He doesn't want to do any action with the mind. He has become so dull. Quarrelsome, we know that. Rage, crocus, alternating affections of disposition to crocus, pulls hair of bystanders. That is also belladonna. Violent. Okay. mind shrieking, it makes too much of noise. Children in. This becomes more, the first symptom can become more in cerebral palsy or mentally retarded cases. Children in, that also part of it. Borax. Borax is one of the best medicines for shrieking. Especially if you lift. If a small kid or 4 or 5, if you lift him or if you wanted to carry him, it becomes restless. Black canina. Okay. So repulsive, reserved kind. These are the medicines which can be thought about. Calcaria is another reserved. Natramute, manganum, stramonium. Okay. Laughing, cannabis indica, again, beretta carb, ignatia, and stramonium. These are the three medicines which comes up in the repertory. It's so easy, you give it if you have the symptoms. Loquacity, lachesis, hyoscyamus, and stramonium. We know that. Nothing special about it. Work aversion to mental. You know that symptoms are the calcaria, kali, bacteria. Bacteria is a stupor problem. Chelidonium, chelidonium mind. China, kid. We know that. Okay. Next one we got phosphorus again. Phosphorus again. Phosphorus mind is very, very, very sensitive. He is very tired. Even exposure to the oxygen or this one it burns. That is a phosphorus. So mind is always restless. Doesn't want to work. He just wanted to relax. Okay. Writing aversion to. Writing inability for. Inability and writing aversion is different. Inability, one medicine is colchicum. Okay. And writing inability. Writing aversion to these medicines. Writing inability for Lyco and colchicum ignatia. These are three medicines. But colchicum gives more. In my experience, colchicum has helped me more than other medicines. If there is nothing, we get it. Okay, sensitive. You know that. Slighter sensitive noise to. Okay. Streaking. I explained it. Oh, that has come a second once more. Going out aversion. He wants to sit at home. He doesn't want to go out. He doesn't want to go with the play with the friends. Okay. Cyclamen. Mind hurry. He wants to do everything in a hurry. If you have to go out, you have to go far, that and then. So faster. Sulfur, we know that. Sulfuric acid. Tarantula again. Okay. Medorinum. And medorinum is one of the best medicine even for the dyscalculia. Okay. Impatience. Okay. Indifference. Dullness. Let me just go to the aversion to. Okay, a little one minute. Just here. Just going to little different approach.
Excuse me, doctor. I think we can have another session. There are
Yeah.
30 to 40 slides are remaining and all are important, so no need of hurrying.
Okay, sir.
It will take a long time to absorb all these things.
And
Because
another
we all know
I was just checking about the dyscalculia. That slide is also there. So I'll just come up in some other time.
we all know the brain circuits are already occupied after 40. It's not easy to absorb all these things.
Okay, sir.
As presentation, so it's time for discussion. Those who like to participate, please raise your hand. You can add something or you can ask some questions. I think Dr. Indrani is ready for asking something. It's always, yes, doctor, please. Yes.
Thank you, sir, for allowing me. Sir, it's a very good topic. You have shown many remedies to us. The remedies were known to us, but you have nicely explained us from ADHD point of view. So we are thankful for that. only two small questions in the mind which I would like to ask you. Sir, actually, what is the role of different potencies in different cases of ADHD? Have you witnessed them?
Yes, sir. See, the potency is just like any other conditions. Okay, even if pathological, what is the sensitivity, susceptibility, all that. But in this case, uh, my experience tells you that higher the potency, faster the action.
Okay.
So I always start with 1M.
Acha. And repetitions?
Repetition, I give it 3 times a day minimum.
Acha.
Okay. And if it's higher the potential, if I go to 1M, 10M, CM, 50M, CM, that way we will go. Then the repetition comes down.
Okay.
Because there are chances of the patient shooting up.
Yeah, descending potencies, you mean.
Huh.
Okay.
So
So,
we
but
have to,
yeah,
we'll have to be little careful in repeating faster. And
okay.
higher potencies in repeating higher potencies. That is considered by a
Case to case, it varies actually.
very.
Sir, is there anything specific you have observed that certain medicines work in certain potencies only in ADHD?
Yes.
Like belladonna, stymonium, hyoscyamus,
Huh.
natrium.
If the metals are given, you have to give it in the higher potency.
Okay, so that's a good input for us. Okay.
If it is a plant and this one, because it becomes slow action is because it becomes faster action. The other one becomes very little slower in metals. Plant acts faster, but the response we get it is for a short time.
Okay.
Okay.
So,
And metals, if we start getting the response, it becomes smooth movement.
okay.
Here we'll have to keep on watching whether the action of the medicine slows down. When to repeat, how to repeat. So that is why
Okay.
daily interaction with the patient or
So
parents.
follow-up has to be there. Follow-up has to be there with the
Yes.
patient. Okay, okay. Sir, and how does homeopathy address the underlying cause of ADHD from homeopathic point of view?
See, we
Because
have
we get diagnosed cases of ADHD, but according to the we see ailments from. That is there.
ailments from. Ailments from. That is most important. If you don't get anything, you have ailments from.
Ha. Because symptoms are common for ADHD. Yeah.
But ailments from differs. If you don't have any other symptoms with the patient comes with the just diagnosis, okay, ADHD.
Correct.
Okay, they will send you, okay, this is the cause, history will come, patient may not come, some relatives will bring it, we'll have only this. So we have a specific point, if we get it, ailments from, that is more than enough for to prescribe.
Okay. So we should stress for that. Okay.
We have to. That is why every part, every aspect of the case is more important. Sometimes AF becomes more important. Sometimes miasm becomes more important.
Yeah. So syphilitics are only are emergencies. Syphilitic miasms are emergencies. They keep biting, tearing things. Yeah.
Sometimes we take cases for 1 hour or 2 hours. We don't get anything. We get one symptom or one line.
Okay.
We will say we will get confused. What are we going to prescribe?
Correct.
Yes. Okay.
Okay.
So the main problem
Thank you, sir.
Yeah. As mentioned by Dr. Stuart Close, on who is went out for observing the birds. First of all, we know where to look, how to look. That's a more thing. Especially the homeopathic philosophy must be more bother about that. Then do you mention about this cause of this ADHD? I think underactivity is the most important thing because the parents will not allow the children to act normally. They are always in restricted way. They're the upbringing. That's another cause. It's always hyperactivity. Maybe the situations are not conducive to a child, especially nuclear families. Then again, the nature of medicine also important. For example, in case of aconite, as rightly mentioned by Ken, it is not the conditions, but when the patient is a strong patient, then the cause is a strong one and the manifestations are strong, then aconite indicates. So the homeopathy philosophy needs to understand a lot of things beyond the symptoms, beyond the similarity. A lot of logic must be applied. So a comprehensive study on textbook material is more important than other textbooks.
Material Medica stands out much better than anything.
Yes, textbook of, for example, the Dandam textbook of Materia Medica, then N.M. Chowdhury, Ken's Materia Medica, these are textbooks. That's most important thing. Dr. Ram Barvesta is another experienced person. Yes, sir. With a strong voice. Yes, sir, please.
Thank you, Dr. Manoj ji, and thank you. Yeah, namaskar everyone. Congratulations, Dr. SADAT SAIT, sir. Very
Thank you,
nice
sir.
presentation. ADHD. Very good. Describe the many kinds of medicine. Really, beauty of homeopathy. Very, very thanks, sir.
Thank you, sir, for the lovely words.
Yes. Yeah, we all know that this homeopathy is a totally practical system of medicine. There's no much complications, no technicalities are there. Very simple. As mentioned Dr. Sadhu said, what is the presentation of the child? That is most important. The gestures, the mannerisms, the how he reacts, how he responds. That makes homeopathy the most simple thing.
We
Simple.
complicate.
Yes.
We
Pardon?
complicate homeopathy.
Pardon?
We complicate homeopathy.
Yes, yes, with so unnecessary explanations as some theoretical, as mentioned by Hahnemann, cunningly devised for conveniences are all these sciences, or the methodology, the mechanisms are often cunningly devised for convenience, as well as ambitiously wasting the time and talents. That's another beautiful narration by Dr. Hahnemann. If anybody would like to participate, 1 or 2 minutes is remaining. As I mentioned, it is not easy. A lot of inhibitions are there from our part. At least around 30 to 40 people are listening, but nobody is responding. What is the reason? I think they're not listening to our program. They may be doing some other works, maybe the time of clinic or the dining table or some other attending some other Zooms simultaneously. That may be a reason. A lot of hundreds of reasons are there, I think. And time for wind up session. I am once again inviting Dr. Daniel to express a lot of thanks. Yes, please. Please unmute, sir. Please unmute.
Yeah. So thank you again once upon. Even your last lecture was very informative to us. This topic stands to be, difficult for a homeopath to approach. But with your vast experience and your treated cases, we all are really happy, and we have gained much explanation about the drugs in ADHD. So if your third session, if you have some time, we will definitely be happy to hear you again. On the from the IFPH all members, I literally thank you from my heart. And thanks for teaching us these remedies for ADHD. Thank you, sir. Yes.
Thank you, sir.
You. He is an enthusiastic person. I think that is the keynote of Dr. Sadhu Said, always enthusiastic with his presentations. So the remark, let me conclude today's English edition. Hope that we'll be back again tomorrow. Till then, goodbye. And Dr. Shaila to continue the program in Malayalam.
Thank you, Dr. Manoj. Thank you, Dr. Sadat Said. Thank